Miracles come in all shapes and sizes. Sometimes miracles come in the form of healing, comfort in time of trial, or provision in time of need. And sometimes we witness a miracle when we see how God prepares a wide variety of people to come together to bring healing and ministry to generations to come. Around the turn of the 20th century, two pioneering approaches to healthcare were born. On the one hand, Ellen White and John Harvey Kellogg were pioneering health ministry in a unique way as an integral part of the ministry of the Seventh-day Adventist Church, combining spiritual insight with an emphasis on healthy living. On the other hand, osteopathic medicine was being pioneered by Dr. Andrew Taylor Still, a Missouri physician whose holistic concept of wellness stressed preventive medicine, healthy diet, and keeping fit as necessary complements to traditional medical treatment. At the time, no one could have foreseen how God would bring these two disciplines together to change lives. These two approaches to healthcare served as the foundation for two hospitals in the greater Dayton, Ohio area. Grandview Hospital grew to be one of the largest osteopathic institutions in the country. Across town, Kettering Medical Center became established as a provider of innovative, high-tech, high-touch care in a Christian atmosphere as part of the healthcare ministry of the Seventh-day Adventist Church. Then, in June of 1999, Kettering and Grandview Medical Centers joined together to form the Kettering Health Network, the only organization in the country where allopathic and osteopathic care are provided together in a faith-based environment. This unique combination has been a blessing to our patients, and it has resulted in remarkable growth, a spirit of innovation, and a striving for excellence. External validation occurred with Kettering Health Network's recognition by Thomson Reuters as one of the top 10 health systems in the country. This occurred the very next year after the network was notified that an unprecedented 4 network hospitals were designated among the top 100 hospitals in the entire country. Grandview Medical Center has demonstrated top clinical quality a rare 7 consecutive years in a row by receiving the Distinguished Hospital Award for Clinical Excellence from Healthgrades Incorporated. This is an accomplishment fewer than 50 of America's 6,000 healthcare facilities can claim. Kettering Health Network now covers the largest geographic area in the Dayton market. Our network employs over 8,000 people and includes 5 acute care medical centers, a behavioral health care center, and more than 50 satellite facilities. Most residents in our 9-county service area are within a 10-minute drive of a Kettering Health Network facility. But caring is measured in much more important ways than facilities and market reach.
They put you so at ease, and they made you just feel comfortable, very comfortable. So they took a lot of your fears away.
I'm getting my energy back already, feel better. The staff is wonderful. They've been very significant in my recovery, and I can't say enough good about them. They are wonderful.
Kettering Health Network carries out its mission around the world. Our physicians, nurses, clergy members, and other professionals have provided direly needed medical care in more than 24 countries over the past decade. In recent years, our doctors have provided Christ-centered care in Peru, Haiti, Zambia, Paraguay, and Venezuela. On the home front, we provide help to Dayton's working poor as principal sponsors of Good Neighbor House. Since the early 1990s, Good Neighbor House has provided the underserved population with food and clothing, as well as medical, dental, and vision services. Within the network, we seek to provide compassionate counseling and support. Kettering Medical Center's Pastoral Services Department is the only Adventist counseling center that includes a focus on supporting pastors and their families. Our Counseling Care Center offers confidential support, counseling, and growth seminars from a Christian perspective. It also specializes in clergy of all denominations, reaching out to them with a special hotline where they can call in if they are in trouble. We also have a 12-day program for clergy who are experiencing burnout. Our clinical pastoral education brings clergy, seminary students, and laypersons from different denominations together to practice hospital-based pastoral skills under the guidance of trained chaplains. Our grief recovery support groups offer support to those who have lost family members and friends through death. Kettering Health Network's Faith Community Nursing Health Ministries program develops and trains health ministry teams who serve congregations by providing holistic nursing services to their members. In addition to ministering to our community and our patients, internal ministry is taking place all the time at Kettering Health Network. Doctors and staff live their lives as ambassadors for Christ, resulting in people giving their lives to God. At Kettering Health Network, most of our patients and staff members are not Seventh-day Adventists, but they are thrilled to be a part of Christian-based ministry. Every day, our dedicated, skillful physicians and staff participate in a miracle, continuing the mission of the Master Healer. And it's that mission that defines who we are as we seek to make a significant difference in the quality of life in all of the communities we serve.
You're facing the most major surgery of your life. You come in, and you have such a positive experience. It's incredible. You can't put a price tag on that. And how do you thank people for saving your life?